10 bizarre medical conditions you won't believe exist. For countless years, people have been endlessly fascinated by the mysteries of the human body, and they have frequently pondered questions such as: what is the function of this part? Is it possible for a human to live without this? Why does it work in such a specific way? These inquiries demonstrate an enthusiasm to acquire additional knowledge regarding the human body. Studies and research aimed at curing illnesses and conditions, as well as saving lives, progress in tandem with the development and occasionally progression of these ailments and illnesses. Nonetheless, even though humans have been studying the human body for centuries, there are still many examples that have not been discovered or that are only now being discovered. These exceedingly uncommon and peculiar diseases are included on the list of odd occurrences that have been documented. Number 10. Syndrome of the Auto-Brewery. Auto-Brewery syndrome, also referred to as gut fermentation syndrome, is a peculiar medical condition in which a person experiences intoxication from alcohol through abnormal gut fermentation in the small intestines. This abnormal gut fermentation is brought on by an overgrowth of certain kinds of fungus. The fermentation of carbohydrates, yeast, and bacteria that flourish in the gut results in the production of alcohol. Alcohol can be produced from any food or drink that contains carbs, yeast, or bacteria. Among the symptoms are discomforts and aches, notably those in the stomach, bloating, alteration in bowel motions, fatigue, sinusitis, discharge from the nose, and coughing that produces phlegm are all symptoms of this condition. Difficulties in concentrating, remembering, and processing information. Sugar cravings. Dietary adjustments and cutting back on foods high in simple sugars, processed carbs, yeast products, and foods spoiled by mold are the primary forms of treatment for this ailment. To treat nutritional deficiencies, a person who has this illness may also require medication, such as vitamin and mineral supplements. This is because the person has a deficiency in certain nutrients. Number 9. P.S.A.S. stands for persistent sexual arousal syndrome. Those who suffer from the condition known as persistent sexual arousal syndrome, PSAS, which is also known as persistent genital arousal syndrome, PGAD, are always on the verge of having an orgasmic experience. Orgasm provides temporary relief from the symptoms, but they can crop up again without warning after a few hours have passed. Because PSAS makes it unable to carry out the activities of daily living, the condition can result in ongoing physical discomfort, stress, and psychological challenges. People might experience the following side effects: anxiety, depression, distress, frustration, guilt, insomnia, attacks of sheer panic. While the precise etiology of the condition is yet unknown, treatment is typically provided to manage the symptoms. It is believed that cognitive behavioral therapy, also known as CBT, can identify the triggers, as well as provide some coping methods and distraction techniques. Alterations in medicine, such as replacing synthetic estrogen with plant-based estrogen, may also be helpful in the management of the illness. Number 8. Walking corpse syndrome. A neuropsychiatric condition that is linked to depression is referred to as the walking corpse syndrome, which is also known as Cotard's syndrome. Those who have this illness mistakenly believe that they are dead or that they are missing specific bodily parts, organs, blood, or organ systems. This syndrome is not typically considered to be a sickness in and of itself, but rather a sign of another psychological problem. Among the symptoms are efforts to inflict injury on oneself, to the point of being mute, illusory notions of one's immortality, illusions that one is on their deathbed, already deceased, or no longer exist, insensitivity to pain. Patients stop speaking. Their mistaken belief that they were already dead led to their refusal to consume food. Extreme depression or sadness, melancholia. Voices advising the patient that they have either passed away or are on their way. Medication, such as antidepressants, antipsychotics, and anti-anxiety pharmaceuticals. Therapy, such as cognitive, behavioral therapy, CBT, or psychotherapy, and a combination of the two are typically used to treat and manage symptoms of mental illness. When drugs and talk therapy are unsuccessful in treating mental illness, Electroconvulsive therapy, sometimes known as ECT, may be used as a last option. Number 7. Syndrome of the foreign accent. Damage to the region of the brain that is responsible for speech is the root cause of foreign accent syndrome. When a person unexpectedly wakes up speaking with a strange accent, they have experienced this phenomenon. Stroke, brain injuries, tumors, and other neurological diseases are common triggers for this syndrome. Speech therapy, which helps patients return to their regular speaking patterns, is the most prevalent kind of treatment for apraxia of speech. Number 6. Lack of pain sensitivity present at birth. The inability to feel pain as a result of this condition is present from birth and continues throughout a person's life. It is caused by mutations in certain genes, and in particular, in a pattern known as autosomal recessive inheritance, which involves the inheritance of 2 gene mutations, one from each parent. Individuals who have this syndrome can differentiate between sharp and dull objects, as well as between something cold and something hot. On the other hand, one is not able to feel when their tongue is already being burned by a hot beverage. Regrettably, there is currently no known treatment or cure for this illness. Among the symptoms are the inability to smell, reduced capacity to produce sweat, and anhidrosis. Number 5. Stoneman syndrome. A rare disorder known as fibrodysplasia ossificans progressiva, FOP, sometimes known as the Stoneman syndrome, is characterized by the gradual transformation of the body's connective tissues into bone. A gene mutation is what causes this condition, which affects 1 in 2 million people. The symptoms of the illness typically begin in the upper back and neck and work their way down to the lower body. Via a process called heterotopic ossification, a second bone can develop on top of the first bone, HO. Due to the intrusive nature of the treatment, attempts to remove the second bone through surgical means may result in massive bone growth. As a result of the stimulation of bone formation, a person affected by this disease may experience a loss of mobility following even very mild trauma. Number 4. The Alice in Wonderland complication, AIWS. This neurological condition is also referred to as Todd syndrome in some circles. In most cases, this will result in migraines, which can cause a person's body image to be distorted, including the perception of the size of their head, hands, and feet. Patients may also suffer hallucinations and a sensation of time going either slowly or swiftly depending on the treatment they are receiving. Regrettably, there is currently no treatment that has been verified as being successful for AIWS. On the other hand, a treatment plan for migraines includes both migraine prophylaxis and a migraine diet, which may be of some use. Number 3. Syndrome of progeria of Hutchinson and Gilford. The Hutchinson-Gilford progeria syndrome is an incredibly uncommon condition in which a person begins to show signs of fast aging at a young age, and continues to do so throughout their lifetime. It is estimated that more than 131 cases have been recorded in scientific literature across the globe since 1886. The incidence rate is 1 in 4 million. Among its symptoms are the following: aged-looking skin, alopecia, hair loss, fragile and brittle bone tissue, failure of the kidneys, anomalies of the joints, vision impairment or loss, a reduction in the amount of subcutaneous fat. There is currently no treatment available for this ailment. Zokinvy, Lanafarnib, on the other hand, was granted approval by the Food and Drug Administration, FDA, of the United States in November 2020. This medication can help lessen the likelihood of passing away as a result of the disease. Number 2. Alkaptonuria. An inherited condition referred to as alkaptonuria, also known as black urine disease, is characterized by a darkening of the body's tissues due to an accumulation of a chemical known as homogentisic acid. This condition is also known as black urine disease. Also, the illness inhibits the body from fully breaking down 2 amino acids known as tyrosine and phenylalanine, which are accountable for the body's pigmentation and are responsible for the disorder. Unfortunately, there is currently no therapy or cure available for this illness. Number 1. Parasitic conjoined twin. The condition known as parasitic twinning occurs when one of the fetuses stops developing while the other is still in the uterus. The parasitic twin can grow recognizable body parts because it is linked to the other fetus and can do so. There have been very few documented instances of this phenomenon that have been made available to researchers up until this day. What do you think about this video? Do let us know in the comments section below. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.